everybody, it's Dr. Alex Earle here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earle. And today we have a very special Hump Day. Not sure if you guys remember, I think on Monday I sent out a little story there. I said we had a big surprise for you. Well, here it is. This is what we're going to be doing here today. So, as some of you may know, I have been chosen to speak at the big aesthetic meeting that's happening right now, actually starting tomorrow, right here at Miami Beach. So this is what they call the aesthetic meeting, okay? The aesthetic meeting, you can see there, 2023. It's a meeting put on by the Aesthetic Society, which is basically the largest aesthetic surgery society in the US and perhaps the world. And so that means that this is pretty much the largest aesthetic meeting in the world, and it's happening right here in Miami starting tomorrow, okay? And as part of that meeting, I sent our experience that we have here at Pure Plastic Surgery with the Ultrasound Guided Gluteal Fat Transfer. You guys probably know Ultrasound Guided BBL. As many of you know, I'm an expert at Ultrasound Guided BBL. I've been doing it since 2019, and so I've basically accumulated that data. I sent it into the Aesthetic Society. I thought it was very important to present, and that's what we're doing here today. And guess what? You guys are going to get a sneak peek. You're going to be the first ones to get my presentation, which officially will be done this Friday at around 2 p.m. And so we're going to be presenting that at the meeting in front of hundreds, if not thousands, of aesthetic surgeons, plastic surgeons that are coming in from the US and from all over the world. All right, and you guys get to see it first. A lot of you guys have been following me on Instagram. You kind of know about this already, but I know we have a lot of new people from TikTok. What's up, my TikTokers? Thank you so much, and please go ahead and send us those likes and those dinosaurs. I love those dinosaurs. But on TikTok especially, you know, whenever I put up a before and after BBL, there's a lot of people on there that are worried. They're like, well, isn't that supposed to be a very dangerous procedure, right? And so I try to explain it on there, but now if you were ever wondering, you know, does the BBL, is it so dangerous, why are you doing it? Then this is going to be the perfect talk for you, because we're going to go through this right now, and I'm going to show you how you can make the BBL actually a very safe procedure when it's done in the right hands with someone with a lot of experience and they're using the ultrasound, okay? So here we go. So here's a talk. Actually, the name of the talk and the paper that we're writing for the medical literature is called Augmented Safety Profile of Ultrasound Guided Gluteal Fat Transfer. This is the largest study to date of anyone anywhere in the world, okay, with over 1,800 patients, which is the experience that we've had here at Pure Plastic Surgery, okay? So, yeah, I don't have any disclosures. That means I don't get paid by any companies. There's no company that is paying me to say this here today. All right? So, about me, some of you guys have been following for a long time. Some of you just started, okay? But I am a double board certified plastic surgeon. That means I'm certified by the American Board of Surgery, which is general surgery, and the American Board of Plastic Surgery. These are two real boards, official boards. These are boards that are under what they call the the American Medical Specialties, the American Board of Medical Specialties. So I'm a double board certified plastic surgeon. I've educated and trained in very well-known places such as Princeton, NYU, University of Miami, and Duke. Okay. Before starting Pure, I was a staff member at Cleveland Clinic here in Florida. A member of several societies, okay, on IG and TikTok, you know, I'm Dr. Alex Earle, but most recently, I'm also the president of the World Association of Gluteal Surgeons, okay? And why are we talking about this, right? So I know a lot of people, especially on TikTok, they're like, well, isn't the BBL unsafe? Aren't people like dying like left and right due to the surgery, okay? And that's still out there in the media, but the reason that we know about this is because before 2017, there was an official study that came out that demonstrated that the mortality rate for BBL, okay, gluteal fat transfer, was approximately 1 in 3,000, which is very high. It was the highest of any aesthetic procedure at the time. And so yes, at around 2017 or before 2017, that mortality rate was way too high. And why is that? Because if you take your cannula, the cannula that you're using to transfer the fat, and you put that too deep, if you get it into or deep to the muscle, you can injure some very, very large vessels, which are called the superior and inferior gluteal veins. If you injure that vessel, as it's showing here with the cannula, you basically make a hole in the vein, and then you push fat through it, you're going to get what's called a fat embolus. And that fat is going to travel from that vein in the gluteal area all the way to the lungs. It's essentially going to clog up the lungs. You can't exchange your oxygen or your carbon dioxide. Basically, you clog up the lungs and the patient dies, and it's almost immediate. There's really not a lot that we can do if that were to happen, okay? And that's what was happening, because before 2017, plastic surgeons and cosmetic surgeons were actually encouraged to put the fat into or deep to the muscle, because they were able to place more fat, you can get more volume, and the fat survived better because the muscle has a very, very good, very robust blood supply. Okay, but the downside was that it was a blind procedure. You didn't know exactly where this vessel was, and if you hit that vessel and you pump in a lot of fat, you're going to get a fat embolus, which is going to be fatal. So after that study came out, the big societies, which is the Aesthetic Society and the American Society of Plastic Surgeons, they sent out some guidelines to all the plastic surgeons out there, and they said that we need to, the most important is the one that's in red here, we need to avoid injecting fat into or deep to the muscle. That is number one, okay? Yes, we want to use a blunt tip cannula, single hole, greater than 4 millimeters, because we don't want it to bend. We don't want any sharp tips there that could injure vessels. You want to be careful as how you angulate the cannula when you're placing it. You want to be careful how you position the patient. That's all true, but really the most important thing that came out of this was that we need to avoid putting the fat deep or deep beneath the muscle or into the muscle, and the safe spaces between the skin and the muscles. They have to be above the muscle at all times. Okay? And Florida took that very, very seriously, because Florida had a high incidence of deaths due to BBLs as well. And so by 2019, it was actually official. It was placed in the official rules and regulations by the Florida Department of Health, the official rules and regulations for office-based surgery, which is what we have here and what most of the clinics in the area have. It was officially placed in there that fat may only be injected into the subcutaneous space, meaning above the muscle, okay, when you're doing gluteal fat transfer. Because that way you can avoid injuring these large, the superior and inferior gluteal veins, which you can see here are in the muscle or deep to the muscle, but they're not above the muscle, right? This yellow layer here, that's the safe space. That's where you want to put the fat, between the skin and the muscle. If you go deep to that into or deep to the muscle, you can injure those large vessels, and that can create the fatal fat embolism. Okay? So what does that mean? That in Florida, if you inject fat into or deep to the muscle and the patient has a bad outcome, you can lose your license. You can lose your license to perform medicine or do surgery here in Florida if you do this. Okay? And after we started doing that, there was a follow-up study, again in 2019, a little bit later that year, which showed that things actually got a lot better. The mortality rate, which was about 1 in 3,000, if you remember, which was way too high, dropped significantly to about 1 in 15,000. Okay? Which is now similar to other very, very common cosmetic procedures that we do every day, such as the tummy tuck. Actually, better than a tummy tuck. Okay? So, if today, 2023, all right, a BBL is not the deadliest surgery out there. Okay? It is on par with other aesthetic procedures that we do, such as a tummy tuck. So that data, whenever they put that on social media and whatnot, the 1 in 3,000, it's outdated. That's not what is happening currently. Okay? But here's the key. In this study, which was a study that involved board-certified plastic surgeons, okay? So not a dentist doing BBLs or a pediatrician doing BBLs or any other crazy thing doing BBLs, which you should never go to, even if it costs $5. Okay? Do not play Russian roulette with your life. All right, this was for board certified plastic surgeons, and all of them, pretty much, nearly all of them were injecting over the muscle. All right, over 99%. Okay. But so now you're thinking, well, that's great, Dr. Earle, so the problem's solved. Like, what's the issue? Well, unfortunately, not in South Florida. This is the sad part. The sad part is that it looked a lot better. So we had 5 deaths in 2017. We had 3 in 2018, only down to 2 2019, 2 2020, trending in the right direction, right? After they made that rule that we could only inject over the muscle, and then what happens? COVID comes, lack of oversight, 2021, worst year ever. 8 deaths in South Florida in 2021. Extremely sad. Okay? So the problem is not solved. So once again, the Florida Department of Medicine stepped in, Department of Health, excuse me, the Florida Department of Health stepped in and put in an emergency order. This was in approximately June of last year. And the emergency order now still had the same rule number 1, you can only inject over the muscle in that subcutaneous space, but it added rule number 2, that the surgeon must use ultrasound guidance when placing the fat into that subcutaneous space for BBL. Must use it, okay? Obligatory. And they limited how many BBLs a surgeon can do in a day to 3, which is reasonable, okay? Because there were surgeons out there that were doing 10, 12, 15 BBLs in a day. Okay, obviously, if you're patient number 15, that you're not getting the same care as patient number 1. Okay, and this was an emergency order because there was, quote unquote, a crisis at the time. But here's the downside: the emergency order can only last 90 days. So it lasted from June through September, and then it expired, and we went back to square one. Okay, so this order was done, but now it's expired. It doesn't exist. Okay, and it's taken them this long to try to come up with a permanent order, and they haven't been able to do it as of now. But the big societies, one of them being the Aesthetic Society, which is the meeting that we're presenting at, okay, and the American Society of Plastic Surgeons, agreed with this rule. And they sent out an official statement, okay, saying that they agree with using ultrasound for this procedure, okay? And they support the mandates by official governing bodies that require the use of ultrasound to deliver a safe fat grafting environment when performing a BBL, okay? And of course some other things as well. You gotta be ethical, right? You can't be doing this in the back, in your backyard or in your kitchen, and things of that nature. And of course, the proper training credentialing, like I said before. Make sure that your surgeon is a surgeon, okay? And better, they're a board certified plastic surgeon, okay? Not a pediatrician, not a gynecologist, or anything else, okay? I've been doing this since before all this happened. We've been doing ultrasound guided BBL since 2019, okay? Way before the emergency order. Why? It just makes logical sense to me. You're turning a procedure that is blind into a procedure where you can see. I can actually see exactly where that cannula is. I can make sure that it's in that subcutaneous space. I know I'm putting the fat in that safe space, and so the risk of a fat embolism is very, very, very low, okay? The only reason I don't say zero is because in life and medicine, nothing is 0% or 100%, but extremely low, okay? And of course, at Pure Plastic Surgery, patient safety has always been our #1 priority, and we do everything that we can to create the safest environment for our patients to try to decrease the complication rates as much as we can. Okay, that's why I've been using this since 2019. That's why we're certified by the Joint Commission, which is the highest level of safety standards that you can have in office-based surgery. And here, let's see if we can get the video. No, that's okay. But let me show you here. If you can see this, that's the cannula. This is the skin. This is that subcutaneous space. This is my cannula in the subcutaneous space. and then here, this is the muscle. And for someone who's never seen ultrasound, it's kind of tough to see, but of course after the appropriate training and everything else, you can tell these layers very, very easily on the ultrasound. So you can easily tell where your cannula is and that you're above the muscle. Okay? So just once again to go over that anatomy and the way that you see it on the ultrasound, of course you're going to have skin at the top, then you're going to have that subcutaneous space, which is actually divided into the superficial subcutaneous space and the deep subcutaneous space, and then below that you're going to have the muscle, which always has this thick white line over top of it called the fascia. And as long as you keep your cannula above the fascia, you're in that safe space, and you're not going to have a fat embolism, or there's extremely low chance of having a fat embolism. Okay? So, since 2019, here at Pure Plastic Surgery, I have done over 1,600 ultrasound guided BBLs. No one in the nation has done that many. Okay? And Dr. Vidal, who started with us about a year and a half ago now, she's already done about 213 ultrasound guided BBLs. Okay? For a total of 1,800 or over 1,800 ultrasound guided BBLs at Pure Plastic Surgery. No other center has done this many. Okay? That's right. And we've achieved that with an incredibly low complication rate. Okay? And I talk about this all the time. Some of you guys have followed me for a while. You know that I do my BBL statistics every December, at the end of every year. Our complication rates started off low and they've gotten even lower. Because every year I'm doing things to try to get, infection rates even lower, seroma rates lower, lipo burn rates lower, need for blood transfusions lower every single year, and that just keeps trending down and down and down and down. So of course eventually we're going to a point where it's just going to kind of level off because we can never get to zero, right? Remember, one thing I always say, the only way to have a 0% complication rate is to not do surgery. Okay? But the overall complication rate was only 4%. Okay, only 4% here. Seromas, 1.2%. Local skin ischemia, little small areas, little lipoburns, 1.2%. And look at this, infection, less than 1%. That is incredible. Okay, this is a surgery that typically has about a 10% infection rate. And our infection rate has been incredibly low because of everything that we do here to try to minimize that risk. Okay? But this is the most important stat right here. No BBL deaths for Dr. Earle, none for Dr. Vidal, and no fat embolism since we started this in 2019. Zero. Okay? Of course, you gotta have great results as well. You wanna be safe, you wanna have great results. Okay? And you guys know that. You see our Instagram all the time. Those on our TikTok or YouTube, you wanna see results, go to my Instagram page. We have a bunch of beautiful results there that you can see. All right? Vice versa, if you want more information and for more informative videos like that, go to our YouTube channel. Go to Pure Plastic Surgery on YouTube. You have all the Hump Day lives there, all the education that you can think of. We'll probably answer any plastic surgery question you can think of on YouTube. Okay? So beautiful results. So what's the conclusion? I think the BBL is definitely safer now than it was before 2017. All right, but it can be done even safer with the ultrasound. All right, it's not a big cost to other plastic surgeons out there. There's really not any large barriers to entry. The ultrasound is small, it's portable, it doesn't cost very much. All you have to do is train, right? It does require training. But once you've trained, it won't add a lot of time to your procedure. Okay? And it has an extremely low complication rate. And it is an excellent tool for training new surgeons to do BBL procedures. Okay? Because once you get out of the residency training program, you probably haven't done that many BBLs. And then if you're training someone that's young, how do you know what they're feeling? You can't. You just have to see. So you want to turn this blind procedure to one where you can see not only for yourself, but you can see what somebody else is doing to make sure that they're doing it safely from the get-go. All right? This is how you get a safe surgeon who's got little experience. by using an ultrasound. Okay? So I think, is my personal view, that the ultrasound should be the standard of care for BBL. In my own personal view, I believe everyone who does BBLs, gluteal fat transfer, should be using an ultrasound. Okay? And so, in that vein, we've started, through WAGS, the World Association of Gluteal Surgeons, we've started a training program here at Pure Plastic Surgery where we train surgeons to use the ultrasound. We've been doing this for about 6 months or so right now, okay? We've trained about 25 to 30 surgeons already on how to do this, and they come from all over the place. They've come from New York, California. We had a surgeon come from Barbados as well, which is really, really cool. Chicago's been a big one as well. You know where we haven't had that many surgeons come from? Which is, I think, ironic. We haven't had that many from Florida, which is very ironic since Florida is where we had the emergency order that was forcing all surgeons to use the ultrasound. And then the order expired and then nobody used it anymore. Okay? All right. And of course, I think we got to keep creating, even bigger studies to show the world really how safe this is. I mean, I already have the largest number ever here, about 1,800, but imagine we combined it with other surgeons out there that are using the ultrasound. I'm sure we could have at least 3,000, 5,000, who knows how many BBLs on their ultrasound, and we can show how extremely safe it is with, extremely low rates of pulmonary fat embolism. Okay, and that's my talk. And you guys got a sneak preview here. You're the first ones to see it because the official talk is going to be this Friday at 2 p.m. at the aesthetic meeting at the Miami Convention Center. All right, but like all talks, and with the one on Friday as well, now we open it up to questions. So I'm happy to answer any questions you may have regarding this or anything related to plastic surgery. We're here for you.
Okay, do you increase your BMI requirement?
I have not increased my BMI requirement. Actually, over the years, I've actually lowered it. So initially, I started doing BMI about 34, then I dropped it a little bit to 33.5, but currently, my max BMI is 30. Okay, why is that? Again, for the same reasons that everything that we do here at Pure is because I want to try to decrease the complication rates as much as I can. I want to make sure that the patient's safety is the #1 priority, and it has been demonstrated with multiple studies that as the BMI goes up, the rate of complications go up. Specifically, blood clots is a big one. So I'm not talking about fat embolism, I'm talking about the blood clots that start in the legs, the deep vein thrombosis, the DVTs that then go to the lungs and cause the pulmonary embolism. So blood clots and respiratory issues, right? The higher the BMI, the more chances of respiratory issues after general anesthesia as well. And also there are higher rates of wound issues. So skin dying, wounds opening, things of that nature.
What other add-ons can be saved with BBL?
So here in Florida, we are limited as to how much fat we can remove if we add on like another cutting or surgical tape procedure, okay? So if you're doing a BBL, so which will come with your Lipo 360, Lipo 360 BBL that comes together, and what you can add on are other areas of liposuctions. For example, if you want to add lipo to chin, lipo to arms, lipo to thighs, that can be added on. That's not a problem. And the other thing that you can add on is the skin tightening procedures, such as Body Tight, okay, which is the one that we have here. So you can definitely add on your Body Tight to your BBL, okay? But what you cannot add on is surgeries where we're making incisions, okay? Because then we can only remove 1,000 cc's of fat. So you typically cannot add on like a breast augmentation or breast reduction or breast lift or a tummy tuck as well. You can't add that onto your BBL.
Can I get a BBL after kidney transplant? It was on 2020.
So most likely the answer will be no. I mean, everything needs to be taken on a case-by-case basis. But the issues that for most patients that have had a transplant, they're on immunosuppressive medications, and you should not be doing a BBL if your immune system is being suppressed. Okay, because the chance of infection is going to go way up, and that's going to lead to potentially a lot of issues.
Can I have surgery if I have ventricular trigeminal?
For those that I'm not sure, it's basically an arrhythmia in the heart. Okay, we typically don't do patients that have any sort of arrhythmia, but again, we could take it on a case-by-case basis. We would certainly need a clearance from your cardiologist. Okay, they would have to tell us that it's safe to do this completely elective surgery in an office-based surgery setting.
Okay. For a regular BBL, do you hit an incision or is that an extra cost, an extra charge?
Yeah, we typically don't charge anything extra. I do try to hide them just kind of baseline as much as I can. A lot of it depends also on basically the frame of the patient, right? So patients that are smaller, more petite, lower BMI, it's a lot easier to hide those incisions because their cannulas are only so long, right? If you're a bigger patient, higher BMI, wider or taller, then a lot of times then we have to make additional incisions so that we can reach all the areas that we need to reach. Okay, but yes, baseline, I try to use the least amount of incisions possible in the most hidden locations, and we don't charge extra for that.
Do you look at wish peaks if they are reasonable for the person?
That's the key. If they are reasonable, then the answer is yes. Okay, if they're not reasonable, I'll still look at them, but I'll tell the patient, I'm sorry, but these are not reasonable. Okay, what makes it reasonable? You want the person that's in the wish pick to have some similar characteristics to you, right? The frame needs to be similar, the skin quality needs to be similar, the age needs to be similar. Because all these factors come into play. And even if you have the same height and weight, the same BMI, same age, okay, but the frame can be completely off, or the skin quality can be off, you're going to have different results. Every patient is unique. But you know what I do like? I do like vision boards. Even if the wish picks on the vision boards are not completely realistic, I like a vision board. I'll tell you why. I like it when patients bring vision boards because I know for sure that patient has thought a lot about this surgery. They have really thought about it and what they would like to look like, and they're fully invested in the surgery because they put in some work into that vision board. Okay. The other thing I like about the vision board is that I typically take it and I put it in the OR and I'll tape it to the wall. And so while I'm doing the procedure, I can always look back and check in on the vision board and try to match things as best as I can. So I love it when patients bring in that vision board and we take a look at it together, and I'll tell them, I think this part is realistic, I think this part is not, and we kind of, it's basically a way to start the conversation.
Do you recommend taking semaglutide before BBL for weight loss?
I believe these new weight loss medications are revolutionary. This is going to be the new thing. And I guess we can, you asked the question, surprise, surprise, we're going to be having that available here at Pure Plastic Surgery very, very soon. So yes, I do believe in semaglutide. It's a great way to lose weight. I personally believe that with these new medications, bariatric surgery is going to go way, way down. Like, the gastric sleeves, the gastric bypasses, all that, people are not going to need that anymore because they're going to be able to lose that weight with these medications. Now, here's the key though. Definitely take the medication, get to your ideal weight, but you have to stop these medications more ideally 2 weeks before surgery. Ideally, you stop at 2 weeks before surgery. Why? One of the ways that these medications work is that it makes the emptying of the stomach slower. And so you feel full faster, you eat less, you consume less calories, you lose weight. That's how they work. But for surgery, when you're going under general anesthesia, you can't have a full stomach, right? That's why we ask you to fast at least 8 hours before surgery. But if you're on this medication, 8 hours is not enough. And you may still have stuff in your stomach, and that can cause issues with a general anesthesia. So definitely use the semaglutide, get your goal weight, and then 2 weeks before surgery you stop, get that stomach functioning how it normally would. We do your surgery, everything goes great, and then if you need to get back on it afterwards in the post-op period, that's all right. But remember, you got to feed that fat for the first 3 months, okay? So you got to make sure you feed the fat for the first 3 months.
Doug, we run out of time. But can you explain why we're having that? Because we're opening the aesthetic center.
Yeah, I get it. Yes. So So the semaglutide is going to be just another line of services that we're going to be providing here at Pure. Because we're now opening the Pure Aesthetic Center, all right, for everything that is non-surgical. So yeah, I mean, super excited about that. We brought in some new staff. I'm not sure if you've met Natalie, but you can certainly follow her. You can follow the Pure Aesthetic Center, and then of course Jenny, who's been here with us for a while. She's a nurse practitioner. She's going to be part of the Aesthetic Center as well, and we're going to be offering pretty much, you know, all kind of related non-surgical things such as your fillers, your Botox, your semaglutide, you know, weight loss. And we're also going to be doing one of the most, like popular things right now at the moment, which is the Morpheus. Okay, so we got Morpheus 8 here on board, which we can use pretty much anywhere in the body, but very popular for the face, the neck, the abdomen, for that skin tightening as well. And we've even included a laser, which is called IPL, so a post-light laser. We're going to have that available to get rid of all like the little blemishes and little spots that you may have in the face and the hands and things of that nature. All right, so super exciting. I think we're going to have a big event for that perhaps in about a month or so. So stay tuned, because if you're here in the area, you're going to want to come down, because we're going to give lots of great specials and discounts at that big event. But more of that to come later. All right. Okay, everybody. Well, I hope this made a lot of sense for you. This is the talk that I'm going to be giving at the Aesthetic Center, the Aesthetic meeting, in 2 days on Friday. So I hope it's good, because there's going to be a lot of plastic surgeons listening to it at that time. All right, everybody. Well, I look forward to seeing you all next week on Hump Day with Dr. Alex Earle. Take care. Ciao.